we are going to discuss about the cardiovascular system anatomy part. It's our 5th lecture. So today our lecture will be according to the brachial artery. We will discuss the branches of the brachial artery and the parts where the brachial artery provided blood supply. So first let's go through the whole process, the whole arteries originating from the ascending aorta and descending aorta and the arch of aorta. So first, subclavian artery, that is originated from the brachiocephalic trunk, which migrate towards the limbs, forelimbs, and give different type of branches. So first, for this purpose, I made diagram on whiteboard. This is the I made it rib cage. Rib cage, or we may call this thoracic cavity. After this is the descending aorta. Descending aorta. And the arch of aorta behind the manubrium, behind the sternum, so it is not here, it is not so clear. For this purpose, I just made a descending aorta and the branches of the subclavian artery. So this, the artery which is moving on the side, it is this. I made a subclavian artery, and after the pectoralis minor, the brachial artery starts axillary artery. This is the axillary artery, and after teres major muscle, it starts to brachial artery. So this is called brachial artery, and at the level of arms, forearm, it bifurcate and form two main arteries. The first one is radial artery and ulnar artery, and radial artery. So friends, as we know that the first portion of the subclavian artery gives rise different branches. One of them we have discussed in our previous lectures. The first one is vertebral artery, which is moving upward, and the main artery, that is from the lower portion of the subclavian artery, which is moving toward the thoracic cavity, is internal thoracic artery. This I made an internal thoracic artery inside the chest cavity, a few branches to the diaphragm. This is the subclavian, and after the beginning, at the beginning position of the axillary artery, there is a branch called superior thoracic artery, originate and provided to the superficial or upper side of the ribs. And another artery that is originated from the second portion of the axillary artery, there is the lateral thoracic artery. The lateral thoracic artery means it provides blood supply to the lateral side of the rib cage. This is the lateral side and this medial side. So these are the branches providing to the lateral side of the rib cage. And at the third this is the third position, third region of the axillary artery, which mainly providing 3 branches, but I mentioned here only 2 branches. There is the one is anterior circumflex humeral artery and the posterior circumflex humeral artery. They provide blood supply to the surgical neck of the humerus bone. So now I will write the names. These called as lateral thoracic artery. Thoracic artery. Anterior and posterior. Anterior and posterior. Circumflex. Humeral arteries. In this branch originating from the first portion of the subclavian artery, there is the internal thoracic artery. So I will write here the internal thoracic artery. Internal thoracic artery. In this one, that is providing the upper side of the rib cage, that is superior thoracic artery. Superior thoracic artery. Superior thoracic artery. So these are the branches of the subclavian artery. The axillary artery, which mainly provided blood supply to the thorax region of the body. The descending aorta, I made a descending aorta. The descending aorta provide blood supply to the posterior region of the rib cage, of the ribs. And the internal thoracic providing to the anterior side, branches. So they are providing branches to the chest cavity. So this we called as posterior intercostal arteries. Intercostal arteries. And these are the anterior intercostal artery. So it will be anterior, anterior intercostal arteries. Intercostal mean between the ribs. So they provided blood supply to the muscles of the rib, to the muscles between the two ribs, and also to the bone of the ribs. So this is the whole about simple branches which we have discussed in the previous lecture. So now we are going to discuss about the brachial artery and the branches of the brachial artery.